Namaste everyone, I am Dr. Amit here. So welcome back to my YouTube channel at the rate Dr. Amit Official, your place for simple and high impact medical learning. So if you haven't subscribed yet, make sure to hit the subscribe button and stay connected for more such videos. So in our last video from microbiology series, we talked about enterococci. So in today's video, we are going to focus on an important gram-positive bacteria called Clostridium difficile. So this is an exam favorite bacteria for USMLE, PG and MBBS exam, and I will explain it in a simple and clear and exam oriented way so you can understand it easily. So stay focused and let's get started with our today topic. So now let's talk about Clostridium difficile. Okay, so talking about the lab feature of Clostridium difficile, so it is a gram-positive bacteria, anaerobic and spore-forming bacillus. Okay, it's a rod-shaped. Okay, now why it is important? Because it causes antibiotic associated diarrhea. Okay, so the classic disease caused by Clostridium difficile is pseudomembranous diarrhea. So why and how it causes pseudomembranous diarrhea? So we all know our gut has some healthy flora. Okay, so when we take antibiotics, okay, so when we take antibiotics, it destroys our normal flora. So when the normal flora get destroyed, then Clostridium difficile grow over there, and the Clostridium difficile produces toxin. Okay, and that toxin damages our colon and it leads to pseudomembranous diarrhea. Okay, now while talking about the toxins produced by Clostridium difficile, so it produces two types of toxins. Okay, one is toxin A, which is called as enterotoxin. So the word entero means it affects the GIT. Okay, and it causes diarrhea. And the second one is toxin B, that is also called as cytotoxin, and it damages the mucosa and it causes cell death. Okay, now moving forward, what are the common triggers, or we can say that what are the common antibiotics due to which this Clostridium difficile get chance to grow in our GIT? Okay, so the common antibiotics are, one is clindamycin, then penicillin group, ampicillin, cephalosporin and fluoroquinolones. Okay, and also it's not an antibiotic, PPI. Okay, PPI groups of drug also are the common triggers for Clostridium difficile infections. Okay, so always remember a buzzword. Okay, mostly in the USMLE exam they give buzzwords. Okay, in the long lengthy vignette, that diarrhea with antibiotics. Whenever you see diarrhea with antibiotics in any MCQ questions, then always think about Clostridium difficile once. Okay, now talking about fulminant infections. Okay, so sometimes it causes toxic megacolon, ileus and shock in a patient. Okay, now we'll talk about what are the symptoms if Clostridium difficile causes infections. Okay, so it produces watery diarrhea, then fever, abdominal pain and leukocytosis in lab report. Okay, so how to diagnose this Clostridium difficile? So to diagnose, okay, so best initial test, okay, always remember the best initial test is stool toxin assay. How? By doing PCR, polymerase chain reactions and ELISA. Okay, and we can also do colonoscopy. Okay, but this is not initial test. Okay, so in colonoscopy it shows the pseudomembrane. Okay, now while talking about the treatment part, okay, many time MCQ ask from this part also. Okay, so what's the first line treatment? Okay, the first line treatment is oral vancomycin. Okay, or oral fidaxomicin. Okay, but what which is one is the alternative drug. Okay, sometimes in case of alternative drug we give metronidazole, but it is very less prepared. Okay, sometimes you find this option in MCQ. Okay, they don't give these options and they ask about which is the treatment option for Clostridium difficile. At that time you think metronidazole, but most important in the first line is oral vancomycin or oral fidaxomicin. Okay, then for recurrent cases, if anyone is having recurrent Clostridium difficile infections, then what's the mode of treatment? Okay, so at that time repeat the above regimen. Okay, you can repeat this oral vancomycin or fidaxomicin, but still if the cases are recurrent in the patient, then we can do fecal microbiota transplant. Okay, so this is all about Clostridium difficile. Okay, so I think this much information is enough for Clostridium difficile and to tackle all the MCQs related to this topic. Okay, so we'll talk about next gram-positive bacteria in the upcoming videos. So if you like this video, please share it with your fellow medicos and please subscribe to my YouTube channel, and thank you for watching.